Welcome to my presentation on eye movement desensitization and reprocessing, or EMDR for short. I'm Jim Barrick, a psychologist, and I'm here to tell you what I've learned about brains, anxiety, and onions. I'm not here to turn you into a neuropsychologist. However, a brief overview of how our brains are formed and how they function will help you understand how the brain works. Just as you don't need to know the theory of the automobile engine in order to drive it, knowing something about it certainly helps, especially when something goes wrong. Throughout the evolution of animal species, the brain has played a central role in perpetuating the species. As animals became more complex in adapting to their surroundings, so too their brains became more complex. Our brains are composed of 4 parts. The oldest and most primitive part of the brain is the brain stem, and it's about 500 million years old. Then came the cerebellum, appearing about 300 million years ago. Another crucial part of the brain is the limbic system. The cerebrum is the most recent development of the brain. It might help you to understand the functional evolution of the brain if we go a little bit more in depth. The brainstem, the oldest part of the brain, has been called the reptilian brain because it is the basic brain for all reptiles. Animals evolving into higher species also have a brainstem and have developed additional parts of their brains. The brainstem controls sensory inputs and motor control, as well as heart, lungs, arteries, and veins. The cerebellum is the next oldest part of the brain and has been called a horsey-doggy brain. It adds additional functions to allow the animal more mobility and simple learned responses. The limbic system has been called the mammalian brain because it controls the functioning of a warm-blooded animal. It is also the seat of emotional reactions, which will be a major focus of this presentation. The newest part of the brain, the cerebrum, has been called the human brain because it controls all of the functions that make us truly human, including our cognitive memories, our ability to plan and communicate and understand, and to use our creative imaginations. The cerebral lobes are part of the cerebrum that processes all of our sensory information. It sorts it all out, analyzes it, and compares it to our other memories in order to allow us to take action. In the world of computers, nothing so far can compare to the human brain. Let's take a look at how our brain does all this by going deeper into how a brain is constructed. The actual cerebral cortex, sometimes called the gray matter, is only 1/8 of an inch thick and is interconnected through nerve fibers. And we'll dig just a little deeper to see how nerve cells work, because they are the building blocks of our brains. Since this presentation is to give you an overview, you need not take notes because there will be no test. Here we have the picture of a single nerve cell. On the left, you'll see what looks like branches of a tree coming from the center of the nerve cell. Then there's a long fiber moving off to the right, to what is called the synaptic buttons. There is no direct connection between one nerve cell and another. There's a gap between a synaptic button and the dendrite of another nerve cell. Communication takes place between nerve cells when chemicals spill across the gap between the synaptic button of one nerve cell and the dendrite of the next nerve cell. To get a sense of the complexity of the neurons in the brain, let's take a look at another view of a neuron. This picture shows a much more vivid description of a neuron, with many more dendrites that reach out toward other synaptic buttons. Looking at the numbers involved, you can well imagine how powerful the brain has become. So let's take an even closer look at how this takes place. On this slide, you can see how communication takes place chemically. Much pharmaceutical research has focused on changing or altering the chemical communication from one nerve cell to another. Psychological research has also shown that the process of cognitive behavioral therapy, or CBT as it's called, also changes or alters the chemicals responsible for the communication between cells. Only it does it naturally. There are two major differences between the pharmaceutical and the psychological approaches. Medications often produce side effects, and when the medications are stopped, unless something has changed in the person's life, the symptoms will return. Cognitive behavioral approaches rarely produce unwanted side effects and focus on changing a person's attitudes, beliefs, and actions. Based on a person's experience, individual nerve cells are chemically or physically in one of three states. A nerve cell can be in a neutral or a normal state, an inhibited state, or in an excited state. How much stimulation a nerve cell requires in order to fire depends on which of the three states it is in. Since our survival may depend on responding immediately to threatening experiences, the brain may create memories of the threat and keep those nerve cells locked in an excited state. That brings us to the end of our microscopic examination of the human brain, leaving on the note that this incredible organ that controls our lives has tremendous potential, promise, and complexity, while being at the same time very fragile. We are going to start examining two separate yet complementary functions in the brain. The brain contains two separate banks of memories, each with its own strengths and weaknesses. Since our emotional limbic memories came much before our cerebral memories, our cognitive memories are among our most recent brain developments. One can also look at the difference between the two memory systems in a functional way. Cognitive memories tend to be more data-driven. That is, they're more rational and logical in nature. Emotional memories, as you might expect, tend to be more experientially based. That is, based on perceptions and feelings. As one might also expect, the older emotional memories are more associated in sensing and responding, especially to perceived threats to our existence. Let's examine how those two systems of memories work. We can look at cognitive memories as the great deciders, evaluating and developing action plans to accomplish our goals. Emotional memories, on the other hand, are the great responders, taking action in a more immediate way. Looked at another way, if you hear the rattle of a rattlesnake near at hand, you are more likely to react instantaneously without thinking about your logical choices or debating alternative plans. Unfortunately, emotional memories, which are based on our instincts for survival and our experiences in life, can be symbolic in nature and not based solely on our present reality. For example, if we hear a rattle that sounds like a rattlesnake, we may respond spontaneously with anxiety. Even if the rattle is in a baby's hand, it may stimulate an emotional memory based on our real-life experience with rattlesnakes, or a symbolic experience such as seeing and hearing a rattlesnake's rattle in a movie or on TV. The limbic system does not differentiate between the real and the symbolic, and the resultant anxiety will be the same. In our next slide, we'll be exploring psychological treatments for anxiety. To give you some idea of 4 CBT approaches to anxiety reduction, I've listed them here with a very brief description. There are particular benefits to each technique. Systematic desensitization is a technique that uses visualization and may be more efficient in dealing with situations that are not easily duplicated. For example, treating someone who is afraid of flying can be done by having the person visualize approaching, boarding, and flying without having to go to an airport. In vivo desensitization is a technique that treats people in an actual fearful situation. Some airlines, for example, have specific programs where people are treated at the airport and in an airplane. EMDR is a specific technique for visualizing and evoking old emotional memories in order to reduce the anxiety. EMDR appears to resolve emotional memories in a way that is similar to a normal sleep pattern called rapid eye movement, or REM, or REM. Flooding is a technique that attempts to provoke anxiety and maintain it at a high level until it is naturally extinguished. Flooding can either be used by visualizing an imaginary scene, viewing a symbolic scene such as on TV, or in an actual situation. All these techniques are designed to treat the anxiety so that the person can once again function in their life. Here are some examples of the kinds of experience people have that can stay locked in their memories for years or decades. One notable example can be seen on television's History Channel, where World War II veterans, as they start to discuss their memories of what happened over 60 years ago, will be flooded with emotions as they remember their wartime experiences, tearing up, jaws quivering, and choking on their words, unable to continue. As we move on, let us examine the goal of EMDR in light of what we know about how nerve cells and the emotional memories of the brain act. It appears that anything, however remotely connected to a fearful event, can trigger the nerve cells that are locked in an excited state. For example, 20 years after the Vietnam War, one veteran who wound up living in the woods would still hit the ground when he heard a jet flying overhead. So the goal of EMDR is not to replace the cognitive memories. The goal is to reset nerve cells in the emotional memories that are in the locked and excited condition back to a neutral state. To have an understanding of how EMDR works, let's briefly explore the similarities between EMDR and dreams. The unconscious mind is always trying to protect us 24/7, and in its role it constantly monitors our physical and psychological state. If our body needs more oxygen, we begin breathing more rapidly, without consciously thinking about it. If our toes get cold, the capillaries in the toes dilate, and our heart beats a little faster to put hot blood to our cold toes, again, without having to consciously try to control it. These are under the control of our unconscious minds. When we fall asleep at night, our unconscious mind continually monitors us. When we sleep, we lose consciousness, and yet our unconscious mind is alert, making sure we're digesting our dinner and continuing pumping blood through our arteries. Since there is less for it to do at night, our unconscious mind also looks into our memories to see how it may assist us work through any stress or distress we may be having. If we are troubled, our unconscious mind will dip into those memories to create a story, which we call a dream, for the purpose of resolving our inner turmoil. Unresolved conflicts may result in the same or similar dreams for years. When the conflict is resolved, that particular dream typically goes away. Rapid eye movements, or REM, often accompanies the dream state. The psychological technique of EMDR is like REM, only while you're awake. In the next slide, we'll be a little more explicit of how the emotional memories of the brain are triggered. The psychologist Francine Shapiro developed EMDR while walking through a park and thinking about a troubling situation. She noticed at the end of her walk that she was no longer emotionally upset. Reviewing how she reacted during the walk, it dawned on her that her eyes had been making particular movements. This led her to conclude, as she says in her 1997 book EMDR, that, quote, "We are not creatures who respond at random. Rather, we react to an internal, associative reality to allow us to make sense of our experiences. The perception of present events automatically link up to the past in the memory network, and the stored negative emotions can flood through the person," unquote. Next, we'll examine the process of EMDR and give an example. In her book, Dr. Shapiro mentions that when a therapist uses this technique, quote, "In EMDR, the clinician tries to identify the negative experience that set the problem in motion. Sometimes it's obvious. For others, it can be everyday experiences that leave the person permanently marred," unquote. I'm using the example of one of the most common fears, public speaking. In a list of people's fears ranging from high to low, public speaking was just above people's fear of death. In our next slide, we will explore how the process is practiced. Let me give you a heads up here. Unless you are prepared to deal with somebody's emotional turmoil, please don't try this at home or at a party to entertain your friends. Depending on the person's emotional memories, it can be quite intense. It's better to refer to an EMDR-trained therapist than attempt to treat somebody based on this limited exploration. To access negative emotional memories, the patient describes a scene which may be a picture, a feeling, a sensation, or a negative thought. Holding that scene in their mind, the patient focuses their eyes on the therapist's fingers moving back and forth in a particular pattern. After multiple passes, the patient is told to close their eyes, to drop into a relaxed state as they have been trained how to do, and verbally report whatever comes to mind. That becomes the new scene, and the process is repeated, working through all the scenes until there is no anxiety associated with the content. Next, we'll explore how EMDR peels away the connections between the scenes in a rapid way. As we noted earlier, anything, however remotely connected to a fearful event, can trigger off the nerve cells that are locked in an excited state, and that can trigger off an anxiety response. For example, the sound of a baby's rattle, that somehow resembles the rattle of a rattlesnake may provoke an anxiety attack by itself and become what's called a node. It can also be possible for the sight of a baby's rattle to become another, slightly different node because of its association with the sound of the baby's rattle. If the baby's rattle was bright yellow, anything of a similar color may also become a node. Note that while the nodes are more removed from the original rattlesnake sound, they still possess the power to trigger off nerve cells that are already in an excited state. This is how emotional memories get linked from the original situation to anything resembling that original situation. Cognitive awareness of the connection may be totally absent. I'll close with 2 examples from my private practice. I was treating a person for depression for a short time when he developed chronic fatigue syndrome, and he had to take a medical leave of absence from his work. It also prevented him from doing much around the house as he recuperated. His wife became furious with him, and she came in to see me quite concerned that her emotional reaction was excessive, given his actual illness. We started with her focusing on a scene from a recent episode. Using EMDR, it wasn't long until a memory surfaced that she reported as, "When I was 9, coming home from school, if I saw the drapes were pulled shut in the front room window, I knew I would have a bad day." What, you might think, does that have to do with her spouse? As we focused on that new scene, the answer appeared to her. Her mother was an alcoholic, and if the front room drapes were pulled, it meant that the alcohol incapacitated her mother, and a 9-year-old girl had to take care of her mother, who was then dependent on her. My client recognized the connection between her memories of her mother's alcoholic dependency on her and her husband's illness that made him dependent on her. Once the connection became known and she sorted it all out, her rage at her husband ended. In a follow-up contact 6 years later, the woman reported having resolved the conflict with her mother, and she felt no residual anger towards her husband, who also recovered from his illness. Next, we'll explore a developing phobia related to driving. Another patient of mine developed a fear of driving on a freeway after witnessing a fatal head-on car crash on the freeway. That scene generalized to being fearful not only of that freeway, but to others as well. Using EMDR, the patient pictured the accident scene, focusing in on different sights and sounds, until she no longer had an anxiety response. She was able to once again drive on freeways, and on that freeway in particular. Long-term follow-up, 4 years later, the patient reported seeing an accident on the same freeway at the same exit. She reported to me that it hadn't dawned on her that she had no anxiety until several hours later. I would like to finish my presentation by saying that EMDR is only one psychotherapeutic technique in a clinician's toolbox. It is not the only tool, and it's much more useful in some cases than others. And that is part of the art of psychotherapy, knowing which tools to use for which patients and which problems. Psychologists, no different than carpenters, realize that if the only tool you have is a hammer, everything starts looking like a nail. Thanks for watching this presentation. My name is Jim Barrick. I'm a psychologist, Los Gatos, California.